Hi, Mr. Janway and Miss Elander. My name is Alexander Solis, a BYU senior student who's also a passionate mental health advocate. I have created the following presentation with the hope to convince you both to help me change the current mental health system in Utah by expanding the mental health care access to prevent suicide at scale and serving more people in a more timely and affordable manner. This is the outline of what I will be covering in the next slides. Let me start this off by addressing the social problem. Utah has a high rate of individuals with mental illness, but a shortage of mental health providers. Among the ones who need mental health care, some groups are more likely to face barriers to accessing care, including uninsured people, underinsured people, and communities of color. Commercial health insurance coverage of mental health services is often limited as well, which can result in high out-of-pocket costs. Another problem is that the current funding for Utah's public mental health system is bifurcated across different systems, making it difficult to consistently deliver coordinated, effective, and timely treatment to patients. To be clear on the demographics and goals, the target population for my proposed system includes teenagers, young adults, and adults dealing with prescribed and non-prescribed mental illnesses. The geography, everyone who lives in Utah. The outcomes that I would hope to achieve with this presentation: offering ample access to mental health care programs at more affordable prices and higher frequency to everyone. Now here I show you important numbers for your consideration as I continue elaborating on the notion of how urgent I need your help. Suicide is the leading cause of death for Utahns. 1 in 5 adults experiences poor mental health. Over half of Utah adults with mental illness did not receive treatment or counseling in 2019, and the last year only 3.6% of those experiencing anxiety or depressive disorder received the proper help on time. The rest struggle with an unmet need for counseling and therapy. You can tell we are talking about a serious problem here. I invite you to study the rest of these numbers later, since I will not be addressing all of them for a matter of time. Now let me talk about the level view of actors in the system and their respective roles. First, the policy makers. Legislators oversee Utah's county authorities in the provision of mental health services to all county residents, including Medicaid enrollees, uninsured individuals, and other uninsured populations. Second, the funders. The state of Utah provides funding to support the provision of mental health services to Medicaid enrollees and some of the uninsured. These services are primarily provided through the Division of Substance Abuse and Mental Health and the Division of Medicaid and Health Financing. Third, local mental health providers primarily serve adults and children with serious and persistent mental illness and serious emotional disturbances. They are not able to serve everyone in the population. Since 2012, the number of mental health clients has increased exponentially, but the number of providers has remained the same. Now let me address the major funding flows of the current system. As you can see in the graph, the organization of powers is very messy. From the top to the bottom, there are many actors from the government that have a word in the process. Legislators delegate and oversee the divisions of health, and these divisions determine the allocation of funds and who to serve first. Usually, those under Medicaid and private insurances are usually given priority. Mental health services are funded through a state general fund appropriation, which oversees the Utah State Hospital and local authorities. Additional financial support comes from federal block grants, county and local funds, time-limited grants, dedicated credits, agency transfers, payments from Medicaid, Medicare, private insurance, commercial or other third-party payers, and clients who self-pay. But no help comes from the wealthy. They are not considered actors in the process, and this is truly a problem in the system that I want to fix with your help. Ideally, this is how I want the system to look like. The government should continue funding the mental health care access in Utah, but my system will also include the active participation of philanthropists like you and wealthy organizations. Let me share with you my vision. I hope to build a system that can be accessible to everyone regardless of their Medicaid status. A system where wealthy actors like you are involved in the provision of services and not just the government. Then this is what I would take to make a significant increase in the number of people served. First, I want to welcome the help of wealthy Utahns. Their millionaire contributions will make possible the treatment of many more thousands of patients. In fact, with their millions, we could meet the needs of the entire body of Utah people in need of treatment and help. Second, I want to partner with universities. I want to ask them to offer ample benefits to students who choose to pursue a mental health degree. This way, we could eliminate the shortage of providers and have professionals available to meet everyone's needs in a timely manner. Third, I want to demand more help from the Church of Jesus Christ. 62% of Utah residents are members of the church. Then the church can participate more actively in the funding of this new system on behalf of its Utah members and, of course, the non-members. For this to happen, these are the specific changes I want to see soon. First, less bureaucracy and hierarchies in the funding process. People need to get the help they need without too much hassle in between. I also need more wealthy donors, including the church, actively involved in the funding of mental health care access in Utah, starting with you both, Mr. Shanway and Ms. Lander. Having you both as the first philanthropist of my system will enable me to reach the rest of the millionaires in Utah, such as the CEOs of Qualtrics, doTERRA, and Nu Skin. If you all, along with the church, could start funding this new system, then more people could be served in a more effective way. Think about that. Finally, the last change I want to see is increasing the number of mental health professionals. Along with partnering with universities, I will also help create an advertising campaign to attract more students. Ads on billboards and social media campaigns will reach many more potential students. This will help us reduce the shortage of mental health workers in Utah. To wrap up, let me speak boldly to you. I need you to embark on this initiative with your resources, but more importantly, with your knowledge and reputation. You too will be key to the success of my system. I recommend you talk with other philanthropists, wealthy individuals that you know about this system so we can all start overseeing the coordination of mental health care services in Utah pretty soon. I also recommend you help me provide incentives to current local workers to upgrade their mental health degrees and benefits for those students who choose to pursue this career. Finally, with your contributions, I recommend you help me create a statewide system for free mental health e-consultations and screenings accessible to everyone, and also reduce the cost of sessions for individuals with a mental health professional. I know we can do this together. I hope to hear back from you on this proposal soon. Thanks in advance for the opportunity to share my system, my initiative with you.